Just to clarify, a data point on the 86,000 at UNH, that's in the 383,500 that was reported yesterday, right?
I'm sorry, can you clarify that? I'm not sure. So
Sure, I'm on the data
publicly,
dashboard,
yeah.
and it says total PCR tests 83,551. So of the 86 at UNH, those are rolled in there as well, right?
Those numbers are what UNH publicly reports on their website, and the more than 86,000 tests conducted. I believe last time I looked at their dashboard was from the end of July through present day. So, if you're looking at another number from earlier, it would...
No, but I mean on yours, those are rolled into yours, right?
In terms of our testing numbers?
Yep.
So we're currently in the process of working with UNH and other colleges to get automatic reporting of the data. So I'd have to go back and clarify exactly what our numbers include and don't include. Certainly any positive test gets reported to us and we investigate. We've been working with UNH because they brought on so much testing to get automatic electronic laboratory reporting to public health. That's something that I believe is still in process and being ironed out. So not all of the testing that's done by UNH may be captured in what's reported right now on the data dashboard, but the plan is to try and bring that in, in the very near future.
So all the positive test results from UNH are positives,
Correct.
but their tests may not be. So we may not be at 383. We could potentially be, if none of the UNH tests were counted, they could be 400 and change.
In
right?
terms of the total number of PCR-based tests that
Thank
we're
you.
reporting, correct?
Thank you.
Yes, that's absolutely right.
So what you see here is that very aggressive testing protocol that UNH has implemented. We've kind of, for the sake of this slide, we've put some of this in manually, but I think what the doctor was saying is, Dr. Chan was saying, is a lot of that stuff hasn't yet been integrated because it's marrying the two systems. I think it should be done very, very soon in terms of updating it. So what you'll see is something more like this on our data dashboard going forward. But all the positives have been accounted for on our dashboard without a doubt.
But that affects the 1% average rate. So we may not be at
We're actually below
1.2.
it.
We may be way below that, depending on,
Go to the
right?
next slide. And that's why this is below 1. You're absolutely right. So there were a couple days we were at about 1.4 and 1.5% last week. In actuality, we're being conservative because in actuality, a lot of those negative tests weren't being counted. So the real number is here. But again, it'll all be updated on the dashboard. It's just about getting their system to integrate with ours. But I think we're just a couple days away from it.
And similar to the school dashboard, we're not trying to complain, right? We know this takes time, but everybody's watching,
Yep.
and worrying. So
Understood.